bone marrow aspirate concentrate is a way for us to take stem cells out of the bone marrow, concentrate them using a centrifuge, and then inject those concentrated stem cells into a joint or a tendon that is suffering from a problem. Some of the problems that we can treat with bone marrow aspirate concentrate include early arthritis of any joint, a tear of a labrum or a meniscus in the hip or the knee, or partial tears or tendinitis of various tendons, such as the gluteus medius tendon, the patellar tendon, or even rotator cuff tendons. The idea with bone marrow aspirate concentrate is a regeneration of the injured tissues. Whether that's an injured tendon or cartilage or a labrum, any of these structures may benefit from bone marrow aspirate concentrate. Our understanding of the way that bone marrow aspirate concentrate works is by stimulating a reparative response of our own cells within those tissues. In cartilage, for example, there are cells called chondrocytes. These chondrocytes are constantly regenerating the matrix of the cartilage. But when the cartilage starts to decay or degenerate, the chondrocytes are falling behind in their duties, and the damage is occurring more rapidly than the chondrocytes can keep up with repairing. If the chondrocytes can be stimulated to ramp up their efforts and repair at a more rapid rate, they can catch up and repair the matrix in a way that regenerates some of the damage more rapidly. In tendon, we have cells called tenocytes. Tenocytes are constantly repairing the matrix of the tendon. In our day-to-day life, we're constantly sustaining micro-injuries to our tendons. The tenocytes are constantly repairing those micro-injuries. In the case of a partial tear or a tendinitis, the tenocytes are falling behind, and they're not able to keep up with the repair process as quickly as those micro injuries are happening. If we can stimulate the tenocytes to become more active, then they can catch up in their repair efforts and overtake the amount of damage that's occurring on a day-to-day basis, regenerating a tendon or addressing the pain coming from that tendon. Bone marrow aspirate concentrate can be done in a single visit. It's performed without anesthesia here in the clinic. And we have specialized devices that allow us to extract bone marrow cells from the bone with very minimal pain. Everything is numbed. And then we centrifuge those bone marrow cells in order to concentrate them. That's why it's called bone marrow aspirate concentrate. We then inject those concentrated cells using ultrasound guidance so that it's very precise. The ultrasound guidance allows us to precisely target it into a tendon or into a joint or whatever is the injured structure so that it can affect the exact structure that we hope to heal.